Hi, you're worried about your sports injury. You've been hurt on the pitch, on the ice skating rink, in one of the arenas where you're passionate about that activity. And so you've tried some exercises, you've tried some medicine with your family doctor, you've talked to friends, family, and work colleagues about what's the best thing to do for this. Um, and you're just kind of getting worried that this isn't getting better, so you pursued some treatment. The treatment wasn't as effective as you'd hoped, or you're just diligently looking for great information on sports injuries. Well, welcome to Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. Uh, we are very passionate about helping, uh, you know, athletes that basically are, 40 plus years old that have had an injury and want to get back to a sport or activity that they're very passionate about. Um, so what we like to do is start with the reason why this may have occurred, and then what caused it, and then provide you with the best sort of advice we can possible in regards to how we help that and get you back healthy and back to play. Um, my name is Blair Shackley. I'm a physiotherapist of 25 years, and I've worked with people just like you for most of my career. And we've had a business here in Calgary for 17 years called Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. And that's our motto, our team sort of slogan here. And we do really look closely and really help people out that want to get back to an activity. So if you've got a sports injury, a tendonitis or a tendinosis, if you've had that tendon problem for a long time, we can definitely help you with that. Um, Quite often you'll see the family doctor and he'll say, well, you just need to rest it, take this medicine, we'll see how it goes, stop playing that sport, that you're just aggravating that joint or that tendon, stop doing that. Um, you know, and they say come back in 6 weeks and we'll see if it's any better. The reality is that's not great advice for somebody with a sport injury. With sport injury, yes, you should rest for a little while, but the sooner you get started on managing that soft tissue pain, the better. With that, the sooner you start, the better, and we're going to have a better outcome and a faster outcome and get you back to play if we can see you sooner rather than later. Why it happened? Well, usually there's a mechanism of injury that caused the traumatic soft tissue strain, sprain, or fracture if it's that bad. It was a traumatic injury, or maybe a pulled nerve in the leg, or you're just running through some tendonitis, whether it's hamstring tendonitis, calf, some foot pain, some lateral IT band syndrome, lateral knee pain, patellofemoral pain, low back pain, or maybe it's anterior impingement pain in that darn hip. We've seen it all, and we've seen people just like you on a daily basis walking through a clinic that are feeling better, and they're returning to play. And we want to keep you guys attached to an activity, because if you're attached to that activity for as long as possible, you're going to have a healthier lifestyle and a more higher quality of life as well. Um, I can see why patients often come to us and they're quite skeptical because they've probably had some bad advice over the years in regards to how to manage that injury, and they probably weren't given a true rehabilitation cycle to reestablish and restore normal function in that tissue. Most physiotherapy clinics will just get you moving and what I call clinically sort of recovered, but then they don't look at your function. And the difference between a good physiotherapist and a great physiotherapist is the good one will get you clinically stable, but the great one's going to say, okay, now we need to take your level of function to the next level so you're okay to return to playing soccer, return to hockey, or whatever that is, which is really another level of function, and that you need to integrate and start some return to play drills and build the endurance and the balance back into your body. Otherwise, you're just at high risk for re-injury when you get out on the ice or get back on the pitch to play soccer or the baseball diamond, whatever it may be. So again, the importance is very specific exercises for very specific sports. We can simulate that and we can provide that with you. And again, you can slide back and say, well, I'd rather just take some pills and just hope that it gets better the next day. Well, the hope strategy isn't really a great strategy, especially with sports injuries. The other one is the avoidance. So a lot of athletes will say, well, I'll just avoid doing that for a little while. Well, the problem with that is you're reducing your capacity and your potential within the joint, the muscle, and tendon unit. So we do need to avoid it temporarily at the start, but then we need to rebuild you slowly and gradually load the tissue so it rebuilds so you can have a successful outcome. Yeah, and that don't listen to your physician if they're saying, "Oh, you stop doing that sport. You're too old now. You got to live with it. You got to move on." There's a lot of people that continue sports for a lot of years and do very well. And again, you're using your body. You're staying healthy. You're staying active. So you really want to continue sports as long as you can. Um, and you will reach a point where you may want to consider changing sports. Don't maybe retire from one sport and then get into a different one that maybe offloads that joint that you've worn out or that's injured, and get into a different sport. A great example is people, they get really arthritic knees or hips, eventually have to have replacements down the road. Well, we wouldn't tell those people to keep running. If they're arthritic, then maybe they should get in a swimming pool. If they've got great shoulders, let's offload those hips and knees and get you swimming. Or maybe cycling would be safer than running or things like that. So as your body ages, there is definitely different things you can move into, and there are other opportunities to stay healthy and active. Um, we're basically helping and serving thousands of people on a monthly basis, just like you in the clinic, that are frustrated that their sport injury hasn't resolved fully, and they want to really get this better so they can get back to their passion, which is their sport. And um, again, if it is chronic and you've had a lot of problems, even if you can come in, get an assessment done, get some treatment going, 10, 20, 30, 40% pain relief can really get you feeling better and get you maybe back functioning at a higher level, in that sport than you are currently right now. So imagine if you came in for an assessment and you got some pain relief, or you did, a an activity without pain, which then you could stop the pills. You don't have to take any medication anymore because the pain's not there, and there's no side effects of that medication going through the rest of your body. Um, and not having to worry about doing some sort of surgery if the joint is failing and you haven't done enough rehab to really get the true potential back into the muscle tendon unit and build the endurance back into that body part. Um, Being able to do whatever sport you want to be able to do, and returning to that, and really excelling at that and having fun with that, because that's really the quality of life, is that when we can get out and sweat and have some fun and enjoy life. um, but you currently can't because of your current pain, and we understand that, and we've heard all these stories in the clinic on a daily basis. So what we would offer you is that we would start with the reason why and what caused this, and try to figure out from there. And then we'd also look at building a comprehensive treatment plan to take you from sort of A all the way through to Z, and really take your function to the next level, and get you back to that sport on a regular basis. Or maybe it isn't a sport. Maybe it's just getting back to a class, an exercise class, or maybe later on for more experienced patients, it's just about living a more independent lifestyle, not relying on their kids to do stuff for them anymore, being able to comfortably mow the lawn, or do stuff like that out in the yard that they normally wouldn't do. So if any of this is starting to sound familiar to you, then you're probably in the right place. And if you're tired of the pills, you want to get off the pills, and you really want to reduce your pain in that sport injury area of your body, then I'd really recommend that we basically engage. Now, there's a few different ways we can engage. One is simply give us a call and contact us to set up a free telephone conversation. So you can meet with one of our great physiotherapists. They can go over your injury and your history and what happened, and really get to know your concerns and what your goals are to rehabilitate that sport injury. And by the end of that conversation, if you think we're the right fit, then at that point you can just ask if you can become a member. So you can apply to become a member or a client with our team in our clinic. And another way is, if you feel motivated, you love the information you're hearing right now, you love the website, then basically just click the cost and availability contact button, and there'll be some information there you'll have to fill out for us, submit to us, and then we'll try and get in contact with you and see if we can't get you in the next couple of days to really start loading that sport injury and really get it back to where it needs to be, so you can play pain-free again. Or if you're really nervous, a bit skeptical, you've had a bad experience before, then you're probably best to book what we call a discovery. So in the discovery, you get to come into the clinic, meet a great physiotherapist. We'll spend some time with you, talking to you about your concerns and your goals. And then at that point, you can experience our caring environment and start your journey there if you like. And so those are the three sort of ways that we can engage. Alternatively, even today, you can download the free report on sports injuries, and you can basically get going on some of the tips we have for your sport injury. And those might give you what I call that little win. So even just reading that article today, applying some of the simple content that's in that article to your life might give you a little bit of relief and make you feel a little bit better, and get you started down the road to recovery. So again, the big difference is we have time for you. And if you feel we're the right choice, again, we have three ways to contact us. One is the cost and availability inquiry, two is the telephone conversation, and then three is the discovery session where we can see if we can help you. So on that note, I'd like to wish you a happy day. I want you to take care. My name is Blair Schachterly on behalf of the Nose Creek Sport Physiotherapy team at Nose Creek, where we get you moving faster and feeling better. Take care, and I'll hopefully see you soon in the clinic. Bye-bye.